This is Lasma Lackajs. The purpose of this presentation is to demonstrate the usefulness of the Heart Failure Health Storylines application. This app is free for all users and available to download on any smartphone, iPad, or tablet. This app is a great tool for helping patients with CHF manage their health. This app has an abundant amount of uses. Users with CHF can use this app to track vital signs, daily weights, set up medication reminders, an appointment calendar, track their symptoms, moods, keep a journal, track physical activity, low sodium diet education, a food diary, and a support group where users can add family, friends, or healthcare professionals. Questions to ask is where the user can write questions for their healthcare provider and write notes during a visit to the doctor. Health Storylines was developed in partnership with Heart Failure Society of America to ensure patients with heart failure keep their health balanced. This app is relevant to nursing because nurses can educate patients with CHF about all the ways they can manage their health and help prevent readmission to the hospital. Users can share the recorded data in the app with the nurse, physician, and family members through the Circle of Support feature. When opening the app initially, squares appear in different colors with distinctive pictures and are easy to read. Simply tapping on the square desired brings the user to a screen to enter the data respectively. For instance, tapping on Medication Tracker, tap Add Medication, type the medication desired, and the medication and dosage will appear. Navigating in the app is relatively simple. All of the features are readily available when opening the app. Workflow can be tedious and complicated for some features. For instance, when entering vital signs, the user must add each component of the vital sign separately. Each time the user adds a value, it goes to a new screen, which can seem tedious. Also, when adding all the vital signs, they appear out of order. For instance, diastolic blood pressure will appear before systolic blood pressure, which can be confusing to the user. Data entry in the app is relatively quick. For example, when entering medications in the search box, the medication will appear instantaneously as the user is entering it. Results are available for access as soon as the data is saved and easy to retrieve for future reference. Results for vital signs appear both in text and in line graphs. The line graphs are separate for each component of the vital sign, which can be confusing and unnecessary to some users. Information entered in the app is easy to read and understand. The app has large text with pictures, making it easy for the user to navigate through the app. Information and education provided in the app is easy to understand. For example, the low sodium diet education guidelines has plenty of information on how to reduce sodium intake and is written for a broad audience to understand. Self-Care Catalyst Inc. SCC partners with Health Storylines. This app does not provide medical advice. SCC is not liable for injury, death, or any other damages arising out of the use of this app. Privacy can be an issue because personal information is collected, such as name, diagnosis, and medications prescribed. This app has many features. The medication reminder sends notifications to the user's phone at the time meds are due. Users can track vital signs, daily weights, physical activity, etc., and this data can be shared with the healthcare provider. Some limitations are workflow can be tedious and complicated for some features and can require many steps, which can be difficult for the elderly. The presenter would recommend this app because the benefits outweigh the limitations and the app has many great features to promote self-care and education reinforcement. This app is important to nursing because it reinforces teaching to users with CHF about the importance of taking medications, monitoring vital signs and daily weights, and complying with a low sodium diet and physical activity. It is a great tool for users with CHF to help manage their health and help prevent readmission.